Inside the breast, it's like a bunch of grapes. So all the ducts come towards the nipple, and they are the inside are the glands which produce the milk. It's like a bunch of grapes. The opening of the glands in the duct gets blocked, but there is a liquid accumulated inside the breast. Then there are two options. You can just aspirate it with a needle and hope that it doesn't refill. But if it refills, then you have to operate it.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Hello everyone, welcome back to Surgery Simplified, shastrakalasaralshabdomein. Hello doctor.
Hello, namaste.
तो पिछले एपिसोड्स में काफ़ी आपने इन्फॉर्मेशन पास किया है टू मी एंड ऑल द व्यूअर्स आउट देयर. आज किस पर्टिकुलर सर्जरी कंडीशन के बारे में हम बात करेंगे?
मुझे आज इसके बारे में बात करना है कि और एक जो कॉमन कंडीशन है, जैसे हमने बोला कि हर्निया इज कॉमन इन मेल्स, वैसे बिनाइन ब्रेस्ट डिसीज इज अ बिग टॉपिक इन द सेंस व्हेन आई से बिनाइन ब्रेस्ट डिसीज इज अ मेडिकल टर्म. इसका मतलब है जो लेडीज को ब्रेस्ट में जो प्रॉब्लम्स होते हैं जो कैंसर नहीं है. ब्रेस्ट में दो ही चीज बोलते हैं कि या तो वो कैंसर है या तो और कुछ है. वो और कुछ इज बिनाइन ब्रेस्ट डिसीज.
Okay.
उसमें भी 3-4 कंडीशंस है जो एज पर द एज ऑफ द पेशेंट कॉमनली दिखते हैं. ओके. तो इसमें जो 3 बेसिकली कंडीशंस है जो मुझे बात करना है. एक है प्रेगनेंसी के टाइम में जो ब्रेस्ट में प्रॉब्लम्स होते हैं. ओके. दूसरा जो अनमैरिड यंग गर्ल्स में ब्रेस्ट में जो प्रॉब्लम्स होते हैं. और तीसरा जो मैरिड या अनमैरिड बट स्लाइटली ओल्डर लेडीज में ब्रेस्ट के प्रॉब्लम्स होते हैं. ठीक है. तो जो पहला है प्रेगनेंसी में स्पेशली ब्रेस्ट फीडिंग के टाइम जो ऑर्गेनिजम्स बच्चे के मुंह में रहते हैं, जर्म्स, वो जब वो दूध पीता है तो वहां से निपल के अंदर से वो ब्रेस्ट में जा सकता है. और वहाँ पे बिकॉज वो मिल्क है तो मिल्क इज अ गुड मीडियम, तो वहाँ वो ग्रो होता है.
Okay.
और वो ग्रो होके फिर वो पस हो जाता है. तो उसको बोलते हैं ब्रेस्ट एब्सेस, मतलब पस फॉर्मिंग इनसाइड द ब्रेस्ट. इसको और एक टर्म है लैक्टेशनल ब्रेस्ट एब्सेस. व्हाई? बिकॉज अदर देन प्रेगनेंसी वेरी रेयरली यू गेट ब्रेस्ट एब्सेस. You don't get it. See, almost invariably the history is there that the mother is feeding the child when they get breast abscess. So how do you treat this? Again, if the breast abscess is not fully formed and it is what is called is firm, if you only touch it, it is firm, and it is paining and it is red but it is not liquefied, we call it cellulitis. दैट इज इट इज सूजन है लेकिन ऑपरेशन करके कोई फायदा नहीं है. तो अल्ट्रासाउंड करके कंफर्म करते हैं कि अंदर पस नहीं भरा है. सिर्फ एंटीबायोटिक्स देना है, बच्चे को वो ब्रेस्ट से दूध नहीं पिलाना है, लेकिन ब्रेस्ट को एम्प्टी करना पड़ता है जो थोड़ा पेनफुल रहता है, लेकिन उसको एम्प्टी करना, दैट इज द ट्रीटमेंट. तो एंटीबायोटिक्स देना, ब्रेस्ट को एम्प्टी करना ब्रेस्ट पंप से या मैन्युअली, लेकिन वहाँ का दूध बच्चे को नहीं देना. अगर अल्ट्रासाउंड में आया कि लिक्विफाई हो गया है और अंदर पस है तो फिर उसको ड्रेन करके निकालना पड़ता है. अब इसमें थोड़ा प्रॉब्लम क्या होता है कि व्हेन वी इंसाइज द ब्रेस्ट टू रिमूव द पस देयर विल बी लीकेज ऑफ मिल्क एंड इट टेक्स लिटिल मोर टाइम टू हील बिकॉज मिल्क प्रोडक्शन है और वो वहाँ से आता है. अब इट डिपेंड्स कि हमने कब किया. अगर पहले 3 महीने में किया तो वी अलाउ दैट लीकेज टू हैपन बिकॉज इट इज इंपॉर्टेंट दैट द चाइल्ड इज फेड ब्रेस्ट मिल्क. लेकिन समझो 7-8 महीने हो चुके हैं, देन वी टेल देम कि आप अभी ब्रेस्ट फीडिंग बंद करो. वी गिव देम टैबलेट्स टू ड्राई अप द ब्रेस्ट अलॉन्ग विथ ट्रीटिंग द ब्रेस्ट एब्सेस. बिकॉज ऑलमोस्ट 9 मंथ्स में लैक्टेशन हो चुका है, चाइल्ड इज ऑलरेडी ऑन टॉप फीड्स. और अगर नहीं तो फिर we have to face the situation. There's no other way to do it. So the way I do it, or some people do it, is we keep a separate drain
Right.
from one side and suture the wound. So we make a separate, path for the pus and the milk to come out after we have treated it, and we close the wound primarily, right, from the side, and then it's a controlled exit of this. Otherwise, the wound will not heal only. So we suture the wound heals, and from here gradually we remove the drain and try to control the loss of milk.
Right.
So that is about breast abscess. The second thing what we get in pregnancy is galactocele. Now this is not as common as breast abscess, but what happens is that the breast is like a bunch, inside the breast, it's like a bunch of grapes. So all the ducts come towards the nipple, and they are inside are the glands which produce the milk. It's like a bunch of grapes with one duct and then many glands. So sometimes these glands, the opening of the glands in the duct gets blocked, and then they grow big and milk accumulates and it becomes like a big cyst. That is known as the galactocele. Again, this, if there is no pain but there is a liquid accumulated inside the breast, okay, which is seen on ultrasound, then there are two options. You can just aspirate it with a needle and hope that it doesn't refill, but if it refills, then you have to operate it. But that is a planned operation. There is no generally, because by then many times lactation is ending also, and you only remove that without damaging the other things. Here in an abscess, what happens, the whole thing is one big area of abscess, so multiple ducts are there. Here it is a single duct or one or two ducts only which has become a galactocele. So you can remove it like a tumor.
Achha.
Okay. Now we come to the second very common problem which is seen in girls in the age of between 15 to 25. This is a lump, we call it as a lump or a tumor in the breast. Generally this tumor is anything between 2 to 4 centimeters.
Achha.
One of the main features is that there is no pain. Alright, and generally the girl will feel it when she is having a bath or something. She'll feel the lump and she'll come and show. So basically there is very less chance of this being a malignancy, very less chance. However, what we do is we do an ultrasound first to confirm that there is a tumor,
Right.
and under ultrasound guidance a needle is put in and cells are removed. So it's called fine needle aspiration cytology, FNAC. The cytology is done to confirm that there is nothing, that this is not a malignancy. Okay, because if there is a malignancy, then the cells may show something. Now there are two options. Okay, A, if the cytology is negative, wait and watch, keep a track whether it is increasing in size, right, with the help of ultrasound and physical palpation. And if it increases beyond 4 centimeters, do a excision biopsy, means remove the tumor and send it for examination.
Achha.
If it is not increasing, but if the girl requests कि मेरे को निकाल देना, you remove it. Okay. If neither, you can just leave it but keep it under surveillance. But in my experience, most of the times, either the girl or her mother will say remove it. We don't want to take a risk. And personally, I feel that is the better option. So what I do, and many people do, is we take incision in such a way that it will not cause any scar on the breast itself. So I do what is called as a retromammary approach, which means I take the incision in the cleft between where the breast falls on the chest wall, behind the breast, lift the whole breast and remove the tumor from inside. Okay. So that there is no scar on the breast. Because many of these girls are not married as yet, and that becomes an important issue, whether the scar is there on the breast or not. So this is about fibroadenoma. The main thing about fibroadenoma or this lump is it's very mobile. It moves. It is like called as a mouse in the breast, because it can move from one end of the breast to the other end. It's very mobile, it is non-tender, and generally it is totally a benign condition. Why does this happen? It is because of the hormonal changes that happen in girls when they become, they go into puberty, and there are hormonal changes. So it is known as aberrations of normal development and involution, which is ANDI, A-N-D-I. Aberration of normal development and involution means the female breast, right from the time of when she is a girl to teenager to woman, will keep on changing due to either being pregnant, being having milk in the breast, breastfeeding, or if not also. So these hormonal changes keep happening even during the cycle, you know. So these hormonal changes sometimes have a bad effect on the breast and they form these tumors. It is basically hormonal, there is nothing else. The last condition is slightly older ladies, which we call as fibrocystic disease of the breast. So this fibrocystic disease is again due to hormonal changes, but here instead of a tumor, you get a area of the breast which becomes nodular.
Nodular inside?
You know sabudana vada? If a sabudana vada is inside, how it will be?
Okay.
Small, dana jaisa and hard. But pain, there is pain. So the differentiation between fibroadenoma and fibrocystic disease is pain. Second is this pain is more in the mid-cycle. That means during the menstrual period, during mid-cycle the pain increases and then it comes down. Second thing is it feels like a big vati. You know, the whole breast tissue sometimes becomes like this. So the whole breast becomes like a saucer shaped dana jaisa thing which you can feel. There is no specific tumor. So this is again because of changes of hormones, and this you can either use tablets which are countering the hormones like anti-estrogens like tamoxifen, which is a medicine which is an anti-estrogen, or you can also use danazol, which is another anti-hormone tablet which acts at a different level. So danazol tablet or tamoxifen can be given, but these have got side effects, thoda side effects hai. Or you can just reassure the lady that it is nothing. At the most, if there is any slightly bigger tumor, you can do an FNAC and just keep under surveillance. Generally it goes off on its own. If there is pain, oil of primrose, it is primrose is a plant. Oil of primrose somehow is supposed to work very well for this. It is available now in India, earlier it was not. So oil of primrose, if you give, the pain subsides. If it doesn't, you can give ordinary painkillers like paracetamol or ibuprofen. So really managing fibrocystic disease of the breast is not big problem. Usually it is a non-surgical treatment. So you may have only surgery for fibroadenoma or for galactocele and abscess. And one more last condition is sometimes some ladies get blood coming out of the nipple or some discharge when they are not pregnant. And in that what you get is a small tumor within a duct which is called as a duct papilloma. Now that needs surgery because those duct papillomas can in a few cases turn into cancer later. So what we do is we put a needle into that particular tumor and then keep that needle there and make a very tiny incision and remove that duct with that tumor. Because it is causing a bloody discharge. Blood anytime when it comes, you have to always think whether this can be going into a cancer. So duct papillomas also should be operated.
Got it.
So in summary, abscess, which is a lactational abscess, and galactocele, which are basically related to pregnant breast, fibroadenoma, which is in young teenage girls, and fibrocystic disease in older ladies, generally unmarried. It is said that if the breast does not do the function for which it is, which means get pregnant and feed the child, then some problems can happen in the breast, which we will discuss in the next episode.
Sure, alright then. Thanks a lot, doctor.
Okay.
So there you heard doctor all about, this is the term that you use.
Benign breast disease.
Benign breast disease, all of the technical terms, but the way you explained it was very, understandable. So thank you so much for watching this episode, and if you have any queries, anything that you want to ask, please put that us on the comment section and we will get back to you with all the answers. And if you have any suggestions, जो आप चाहते हैं कि डॉक्टर हमको एनलाइटन करे ऑन द सब्जेक्ट, let us know on that as well, and we'll make sure that we come up with an episode. Hit that bell icon for notification, like, share and subscribe to our channel, and stay tuned. Thank you.